West Thames Regional Genetics Service. Many of you here today will have seen a genetic counsellor or will have heard of a genetic counsellor, but for those of you who may not have, essentially we see families who have or are at risk of various genetic conditions, and Lynch syndrome is one of the things that we see, and it's quite a high proportion of our referrals are actually families with bowel cancer and Lynch syndrome. What I wanted to talk to you today was about predictive testing. Many of you here will be from families where Lynch syndrome has already been identified, but you may be one of the individuals or have relatives who are at risk of inheriting Lynch syndrome. And so I wanted to talk about some of the things that we discuss with families in clinic. So the first thing I want to talk about are the two main differences in genetic testing. One is diagnostic testing and one is predictive testing. So Dr. Brady's alluded to diagnostic testing, and that's a term that we use to identify a particular genetic condition in a family. So we don't always identify genetic cause, but a diagnostic test is trying to identify why someone may have developed a particular genetic condition. And I'll come on to predictive testing, but that's a little bit different. So in diagnostic testing, it involves us offering genetic testing to someone where we suspect Lynch syndrome. Most people will have been referred to genetics for that, but not always. And we're now moving to a situation where certain genetic testing will be done by oncologists and bowel surgeons, and that's something that will be the way that things are moving, I think, in the future. But when we do see people in genetics, it's important that a genetic test isn't done without discussing the implications, because for some people, they don't want that information. There are lots of things that come out of a genetic test, and it's not just an answer for why they may have had a particular cancer. And the whole process from being referred to doing the testing on the cancer sample, to doing any testing on a blood sample, to getting results can take a number of months. So some of you may have had experience of this process taking a long time. In predictive genetic testing, that's when we can offer a blood test, a genetic test, to an individual who comes from a family where Lynch syndrome has been identified. So it's a much easier test to do from a genetic point of view. However, the implications are huge for individuals who may have never had cancer themselves, maybe very well, and are trying to identify whether they're at risk of certain cancers. So generally, we recommend that people are referred by their GP or someone else to genetics, and we'll see them in genetics. And we have the luxury in genetics of having about a 45-minute appointment with our patients. So we can cover lots of different aspects rather than a quick 5-minute appointment with your GP where it's very hard to discuss your concerns. So usually people are seen by one of the genetic counsellors or one of the genetic consultants, and we discuss quite a number of issues. So that's what I want to talk about today. But as Dr. Brady said, today is about information that will be useful for you. So please don't be afraid to ask questions. There's no question that's too stupid. So please ask if you have questions. So to start with, when we see someone, we generally send out a family history questionnaire asking them to complete that if we don't already know the family history. And then what's really important is we actually need to know the particular genetic mutation in the family. So it's no good just saying, I've got Lynch syndrome in the family. What we need to do is then go and identify the particular mutation. And what we can do is contact the laboratory that have done the testing in the at-risk, in the individual who's got Lynch syndrome. We can get a copy of that, and then we know the exact spelling mistake that's in the gene, so the exact mutation. And from that, then we can offer predictive testing, and that testing only takes about 4 to 6 weeks. So it's still a long time, but quicker than diagnostic testing. And we usually see people in clinic for those results, but occasionally people like a telephone appointment. So my next few slides are about some of the issues to consider before going ahead with predictive testing. So if someone has a predictive genetic test and the results show that they carry the same mutation, then we know that they are at an increased risk of cancer, and we know that the cancer risk can be high for certain cancers. So this can have an implication on their screening, so whether we recommend extra bowel screening, whether we recommend that they take aspirin, or whether we may recommend for a woman to go and see a gynaecologist to have risk-reducing surgery to remove their womb or their ovaries and fallopian tubes. So this is quite a big deal. It's obviously not just a simple blood test, there's a lot at stake here. We also need to think about implications for other relatives. So an individual may come and may have children who are coming up to maybe their 20s where they might want to have predictive genetic testing, and that can be quite difficult. Some people feel quite pressured to have testing for the sake of their children. There are also options to have testing either before or during pregnancy if a couple wishes to avoid passing on a particular genetic condition to their children. This is something that is not requested very often in Lynch syndrome, but it is an option, and sometimes people aren't aware of that. So I think it's a very personal decision. I'm not going into a lot of detail about PGD, which is pre-implantation genetic diagnosis, but I'd be happy to discuss that if anyone has any questions. So if someone has a predicted genetic test and they're found not to carry the mutation in the family, then that means that their risk of cancer, we usually say, is about the same as anyone in the general population, but we do have to bear in mind that they may have a history of cancer on the other side of the family, so there may be bowel cancer on both sides. So we may actually be recommending screening, but at least we know that they don't have Lynch syndrome. So they wouldn't necessarily require any extra bowel screening, although they may. We wouldn't be recommending aspirin, and they probably shouldn't be thinking about needing to have surgery to remove various organs. So generally speaking, not carrying the mutation is a positive thing, but it can cause lots of anxiety in families, and there are lots of emotions associated with that, which I'll go on to. But if you don't carry the mutation, you can't pass it on to your children. So we use the term psychosocial in genetics just to mean, really, the emotional aspects of genetics and genetic testing. And because we have the word counsellor in our title, people often worry about coming to us thinking that they're coming for a 45-minute counselling session. But for anybody who's been to a genetic counsellor, there's a lot of genetics. And sometimes we don't go on to the counselling aspects if it's not important. However, I would say that in any predictive test, it is important to cover some of these issues. So if you have a predictive test, then usually it removes the uncertainty about your genetic status. It will either be a yes or a no. But that can raise uncertainty in other ways, because then you might wonder, when are you going to get cancer? And I think that can be a real issue for people. A lot of people come thinking that they want a predictive test in order to be reassured, and obviously if you're at 50-50 risk, then there's as good a chance that you may not feel reassured with that. Some people may change the way that they feel about themselves and how they fit in the family, and it can obviously affect your personal cancer risk. It can change the way that you perceive yourself within the family, and I think if people have predictive testing and someone has got the mutation and someone hasn't, that can change the way that you identify yourself. You may have lived your life thinking that you're at risk of something and then discover you're not, and that can cause quite a lot of anxiety. And I'm not sure if people outside the world of genetics and Lynch syndrome really appreciate that it can be difficult to have what we perceive as a good news result. Some people, I alluded to earlier, can feel quite pressured into having genetic testing by their siblings or their parents or their children, and so part of our role is to try to establish, is this the right time, is this the right thing for them to do? I mentioned identical twins. It doesn't come up very often, but identical twins share DNA, so they're exactly the same DNA, and therefore we do have situations where one twin wants to know their genetic status and one doesn't, and so it can be quite tricky. So we have to manage that as best we can, because they will have the same genetic result. One thing about genetic information is that you can't take it away once we know it, so sometimes timing of testing is important. This information can be obtained at any point in the future, but sometimes now might not be the best time. You might be just moving house, getting married, doing exams. So timing is crucial. In genetic counselling, we're supposed to be non-directive as much as possible. What that means is we're not supposed to tell people what to do, but most people come to a medical appointment expecting to have a little bit of guidance, and people can find that really difficult. But our role is to give people the options so that then they can make an informed choice, because we don't know what is the best thing for you. Sometimes you don't know what is the best thing for you, and I think sometimes that's where people come unstuck, wondering, what should I do? But that's why we may see people a number of times to go through what's going on for someone and ultimately come up with the best solution. And predictive testing, as diagnostic testing, can cause a range of emotions, and I think one of the main things is that you won't always get positive emotions from a good news result and negative emotions from a negative result. It can be one or other. There can be survivor guilt, there can be relief from having the information, there can be anxiety, worry about cancer, worry about children. So it can cause lots of different emotions. I'm pleased to say that on the whole, financial implications are not a huge problem for most people. However, it does come up, and we do talk to people about the implications of predictive genetic testing. So my understanding is that the moratorium, that is a protection between you and the government and insurance companies, has been extended in until 2019, so that you do not need to disclose any genetic test information to an insurance company. Now this is mostly for life insurance if you're getting a mortgage, so it's not for small insurance policies. After 2019, we don't know what will happen, but most likely it will be extended. But we always advise that people visit the Association of British Insurers website to get more information. They're a great resource, and what people can do is shop around and find the best insurance company for them. They are not allowed to ask if you've even been seen by genetics, there's a genetic condition in the family, my understanding is, and that you don't need to say whether you've had genetic testing or not. However, it may be in your interest, if you've had a good news result, as in you don't carry the mutation, but you've got a family history of Lynch syndrome, then it may be in your interest to explain that to them. Hopefully they'll understand that information. But the ABI should be able to guide you if you have questions about that. So my final slide is just some of the other issues about predictive genetic testing. So what's really important is that people don't feel that they cannot have screening, bowel screening, just because they haven't had a genetic test. If you are at 50% risk, so if you have a sibling, a sister, a brother, or a parent who has Lynch syndrome, you can still have bowel screening as if you have Lynch syndrome. You do not need to know your genetic status. That's really important. And it's also really important that you have that screening. So just because you haven't had a genetic test doesn't mean that you're not at risk. But one thing that we try to explain to people is just because a test is available, it doesn't mean it's the right thing to do. So it's not always the right thing for someone. And people can feel quite relieved at the end of a 45-minute appointment knowing that they can go away and they don't have to have this test. They can have the bowel screening, and maybe they can explore this at a later stage if they want to. And I've talked about how timing for predictive testing is really crucial. So we try as best we can to support people with that. So that's all my slides. Before I pass over to Demetra, who's going to talk about communicating Lynch syndrome in families, is there anything that you want to ask?
I'm a research nurse, and what's your thought on maybe offering people a 3-month appointment after they've been tested and had a positive result? Just because recently I had a lady, the whole family's recently been tested and obviously positive. And she said it wasn't until she went away and started reading up on it that all these questions came, and I wasn't really in a position to answer all of my questions. And I did offer her appointments, you know. And every time she said she didn't want to have an appointment, she would come out with another question. You know, she was 32, she hadn't had kids. Aunties were having, you know, hysterectomies and just a million questions, you know, things she'd read, things she wasn't sure about, you know, all this sort of thing. And do you think it's worth them maybe having a 3-month follow-up appointment that they don't have to keep if they choose not to?
Thank you for that. It's a really useful question. Generally speaking, what we do with a predictive test is we'll see them to discuss testing. If they decide to go ahead with testing, then we usually see them for their result. And then I usually, and most people usually offer an appointment about a month after that to come up with any questions, because as you say, it's not on the day of their results that they have all their questions. On the day of results, all you hear is yes or no, and I try to keep my appointments brief because they don't hear anything else. That's all they hear. So even if someone's had a negative result, I will still offer a follow-up appointment about a month later. Now maybe a month isn't long enough until we can discuss that with patients, but I do believe it's important to have a follow-up appointment because, as you say, that's when questions come up. If you're anything like me, you'll go straight on the internet and read everything about something as soon as you've got some information. So the other thing that we would really like to do, but we don't have the resources at the moment, is to see people maybe once a year. But what we do in our department is we have a Lynch syndrome information evening every 2 years or so, where we invite everybody who has a mutation to that evening, and it's a way of disseminating information. It's not an individual counselling session, but sometimes we can say to people, make an appointment if you have questions, and we always leave an open door, so people can always contact us if they want an appointment. They don't need to wait to be invited. So we really encourage people to get in touch with their genetic team to make another appointment, because things change, they have questions, maybe something changes in their family history. They might be thinking about starting a family, which wasn't something that they were doing at the time of testing. So yes, I would really encourage people to get back in touch with genetics. Some people do not want to see us ever again, and so it's important that we don't say, you must come for an appointment when they don't want to. But yeah, if you have questions, use us. We're there when we have more time. So, thank you. All right, I'm going to pass you over to Dimitra.